So this is partial correspondence system to the organs of the upper layer of the abdominal cavity on the feet. So this is type 2. The other day we studied type 1 heel system, and according to type 1 heel system, this upper abdominal cavity points are located at the back side of the heel, and this is the side view. So front side is located here and back side is located this side. Okay, so now before we do this, let's see the previous picture what we studied before. Back view of heel, you can see here. So that day we studied this system. This is back view of heel, type 1. Yes, so according to this, this is the upper layer of the abdominal cavity, back heel, and we did this system previously. Now let's see the other system, type 2. Now see the diaphragm lower line here has one more projection on the foot. It passes at the ankle joint level across all of the foot side surface and forms a closed line. That is why in our Indian culture we are wearing pile anklets. Yes, that is also very good. This is diaphragm line all the time, energizing this diaphragm line. We have beautiful tradition in India to wear anklets here. Yes, so this is projecting diaphragm line. Now this is yin side towards big toe. This is the yin side, and the inner this is yin surface of the foot, which carries the areas of correspondence to the internal organ of the subdiaphragm area. Yes, and towards the little toe, this is yang side, towards the little toe, the outer side or yang surface of the foot corresponds to the upper side of the back and also kidneys here. Yes, so in this you can search painful point here, you can search here, and you can search here for stomach or liver. This is according to type 2 heel correspondence system. We have two systems. One is type 1. In type 1 we are focusing back side of heel, but in type 2 we have very good way to see front and back, because we can see the sides. Big toe is front and towards little toe is your back. Yes, so this is left foot and this is right foot, in right foot front, and this is the back side. Good to focus yin surface in the right foot, and good to focus back surface on the left foot. Let's see on the foot. This is the front part, front yin surface. For example, if liver problem, you can search one by one the painful point here, one by one like this. And if patient has stomach problem, you can check the point, or with the help of thumb you can check how, if it is more than pressing pain, then of course yes, maybe there is some disease here. Yes, so this is pancreas area. You can also see here one by one like this. You can check one by one to energize pancreas, duodenum, and this is liver. Now for back, as I told you, left foot for kidney problem or for back. So for kidney, this is very good area to stimulate. You can, after doing good massage, you can put this kidney beans here. So this is kidney beans, white dot facing each other. So after doing good massage, pressing, you can just put here like this, and white dot, both white dot facing each other, and stimulate nicely. You can tell the patient to press from time to time kidney points. You can also, in chronic cases, you can do moxa. Before seeds, you can do moxa. So now let's see one more new system, the partial system of correspondence of the trunk's lower part on the foot vault area, this arch area. Very, very good to treat the abdominal disease, this area. And this partial correspondence of the trunk's lower portion is particularly helpful in cases when there are reasons why some area of the original correspondence in surface cannot be used. For example, when you were studying foot correspondence, according to standard foot correspondence system, you have done stomach, liver points here, yes, and then intestine. This is separate, partial system. So this area is very, skin is hard here and very difficult to find painful point in this zone. So this is independent system, this area, this area, and very good to find painful point here. If some person has digestive issues, you can check a painful point here. This is liver and this is diaphragm line, and below this stomach, liver, intestine, and accordingly you can put the points. And similarly, back side you can see this area, and this is bony part, and for vertebra very good to focus here. And in standard foot system you are finding lumbar points here, but this in this partial system, this is the spine area. So you can find, and sometimes if hip point paining, low backache, this is because bony part, vertebrae are also bony. So you can stimulate this area, and then you can apply magnets. Okay. So in these systems, the big toe corresponds to the head, neck. The areas of the first metatarsal bones corresponds to the thoracic cavity, and the fornix of the feet to the lower part of the trunk. Now the systems lie both on the yin and on the yang surface of the feet. So these systems of correspondence have some advantages. They are compact. You can see, very compact and very easy, convenient to use. The area of correspondence to the organ are easily accessible. To influence, all the points lie along one vertical line. Very easy to influence, as the organ in the human body. Yes. Now that is why each small part we are focusing, that which part is more closer to the body. We have so many systems and we should know all the systems. Sometimes you get result in this system, sometimes in insect system, sometimes in standard correspondence system. Yes, so you should know this also. So this is face, neck, smiling face. Of course, yes, don't forget to smile. Chest area, lungs and heart, and this is the area for your abdomen. Yes, and here you can get painful point very easily because very soft and tender area, and very easy to find. Immediately patient can react to the painful point. Here this is very hard skin, so difficult to find points of stomach, liver, gallbladder. Yes, so in this system, with this consciousness, this system, you can really find the painful point one by one. You can check as per the patient disease, and then as per the reaction you can find the most painful point, and wherever you find the painful point you can put the magnets. Similarly on the back, this is back, spine area, cervical, and this is spine, and here is the low backache points this way, and also kidney point also you can check. This is whole vertebra section, and then here is the kidney point. You can put kidney beans here also. Yes, scapula point here, kidney points here. You can check the painful point, this area nicely you can check this way, one by one you can check, and accordingly you can treat. Okay.